Welcome back to our special series on cancer care during the COVID-19 pandemic. ACCC is here to bring you the quick tips and tools you need right now. Up next, how to set up drive-thru screenings. We can learn from an early adopter of this curbside strategy to reduce transmission. Dr. Catherine Liu is a physician at Seattle Cancer Care Alliance, and she specializes in infectious disease prevention and treatment.
We have been working on developing ways to reduce exposures in our clinic, so reducing symptomatic patients from coming in through our clinic. And so that really forms the principle behind drive-thru testing. We set up our drive-thru testing clinic for both our patients and employees several weeks ago. And essentially what happens here is that patients who call in with respiratory symptoms and who don't have an essential clinic visit are directed to the drive-thru testing site. They have their appointments rescheduled or they use telehealth as an alternative. And we are also currently in the process, expected to go live at the end of this week, to pre-screen all of our patients a few days prior to scheduling to their scheduled appointments for symptoms. And essentially any symptomatic patient will be referred for drive-thru testing, with the idea being to have those test results back prior to their scheduled appointment. And we have a pretty fast turnaround time now for our lab, less than 12 hours. So we're able to get those results fairly quickly. And I will just mention briefly that for our employees, currently the process is that any employee who has respiratory symptoms is asked to complete a symptom screen through an online tool, and subsequently an appointment is scheduled for drive-thru testing. So both our patients and employees really avoids their need to physically come into the clinic for testing.
What do cancer programs need to know about these new protocols for drive-thru screening or parking lot triage?
So, I think essentially that the process is actually quite simple. And for centers that are interested in doing this, I'll just kind of walk through how we have set this up at our cancer center. Essentially, the patient or employee will drive up to the designated area on our campus for drive-thru testing. We do have separate locations for patients and employees. Essentially, we identified two separate parking garages, one designated for patients and one for employees. And ideally, you would like to find an area that's relatively well ventilated. So for our patient area, this is a location that is right at the entrance of the garage, and also an area where we don't have a lot of people coming in and out. Essentially, the patients are instructed to park their car, they lower down their window, and the nurse or medical assistant wearing appropriate personal protective equipment will approach the patient in the parked car and perform a nasopharyngeal swab. We have about a 10-minute time slot for each of these, but the entire process really only takes a few minutes in terms of doing the actual swab. One sort of advantage of this approach as well is that it does allow us to conserve our personal protective equipment supply, which is particularly important in the context of shortages. The exposure is really quite limited among those individuals who collect the samples. So essentially, they're able to wear the same mask and face shields in between patients, as long as there is no contamination during the process of specimen collection. They do change gloves in between patients. We do have reusable gowns, so our nurses and staff do change gowns in between patients, but many other centers using disposable gowns, including our partners at UW Medicine, do keep the same gown on in between patients, and essentially will change the entire set of PPE at the end of a shift, so at the end of or during break time, a 4-hour period or so. And I think that this has really been an efficient way for us to get our patients and employees tested while minimizing exposures in the clinic. And like I said, I think from a PPE conservation standpoint, I think has really been helpful as well, particularly as we develop strategies to ensure optimal use of our limited supplies.
ACCC will continue to gather information on new and best practices during a pandemic. And we'll meet you right back here again next week. Until then, for the entire Cancer Buzz team, this is Summer Johnson. Stay well.